Hello, good afternoon everyone. Dr. Amina here, and I hope you are doing well. It's coming up towards the end of another week, the second week in 2021. So I'm Dr. Amina Goodwin Fernandez, and I help people kick sugar to the curve in order to achieve optimum health and well-being so that they can live life with energy and gusto. All right, so thanks to everyone watching, and I see Simone, Darby, and welcome. So I just wanted to give you all a little snapshot, an idea of the enormity of the diabetes and overall blood sugar problem in the United States, but I believe it is a bit of a problem, or a big problem, in the rest of the world as well, as countries get more and more industrialized, right? But the figures I am going to talk about are going to be related mainly to the United States. And it's pretty dramatic, like I said in the write-up there to this video. Of all of you who will see this video, one in three of you is actually pre-diabetic, and chances are you do not know. You have no clue that you're pre-diabetic, right? And then 1 in 5 of you is an actual diabetic, and there is also a chance that you're diabetic and you don't know. I believe one figure I saw was that maybe up to 5 years somebody has diabetes and is living with diabetes for up to 5 years before diagnosis on average, right? So this is the snapshot of diabetes in the United States. I got this from the CDC website, so everything is right there for everybody to see. And the issue, in terms of the severity, is that diabetes affects about 10% of the United States population is actually diabetic, right? 1 in 10 persons. If you're in a room with 20 people, say your church has 100 people, 10 of those 100 people are diabetic, right? And the sad part is that 1 in 5, right, or 2 of those 10, they have no idea that they are diabetic. So they are walking around fine and dandy, and they feel fine, or they think they feel fine because they've been feeling like they're feeling, for years. And sometimes when, little symptoms and so on happen to you, they sort of creep up slowly. And so you don't get a chance to realize that something is wrong because it happens so gradually. So you think you feel fine and you're going along merrily on your way and have no idea that you're diabetic, right? But if you think diabetes problem is bad, the pre-diabetes problem is even worse, because 30% or so, a third of the US population, is living with pre-diabetes, and out of every 10 people with pre-diabetes, 8 of them have no idea that they are pre-diabetic, right? So say for example, you're in a room with 30 people, right? 10 of those people are pre-diabetic, and 8 of them have no clue. So only 2 of them know that they're pre-diabetic. So this tells you that there is a lot of underlying abnormality, we can say metabolic abnormality or blood sugar abnormalities, right, in a huge percentage of people. A third of the population in the United States with these blood sugar abnormalities and don't know. And maybe you watching, listening, is one of those people and you have no idea, right? So very important to be sensitized, to actually realize that this is a problem affecting so many people, and that so many people are unaware, and that you really, really, really need to go and get sorted out, right? And find out what the situation is. And if you have it, then to start making the steps to, reverse, right, these issues. Because certainly pre-diabetes is completely reversible. And in some situations, diabetes is also quite reversible, right? If you catch it early enough. Or if not reversible, it's very manageable with a lot of dietary modification and not necessarily too much medication. I mean, sometimes in the beginning you need medication, but if you can adjust your diet, aggressively, then there are many cases where people are able to control it now with just the diet and get off all the prescription medications, right? So very serious problem. Now the issue with diabetes as well is just the cost. So a lot of times people think, oh, well, I'll just go and take some medication, but then you have to pay for the medication. And then even if you have insurance, a lot of times there are co-pays, and then these insurance companies are always changing their rules, and depending on what's happening in society, you know, the copay might go up, or if your employer changes insurance plans, then your copay might go up. And so we have sometimes, you know, we know of persons who have copays of, you know, $300 for all their medications combined, and I'm sure it's even more than that sometimes, and that's per month. So imagine having to spend $300, $400, $500 per month, just your copay, just your portion, you know, for all the medicines that you have to take, right? Then what about the copays for doctor's visits, etc., right? So the cost of the medicines and all the care and procedures related to maybe complications, your eye problem, eyeglasses, eye surgery, etc., etc. So just the cost of care is extremely enormous, right? But then not just cost of care, medications, you know, treatments and so on, but what about the opportunity costs? What about all the time that you have to take off from work to go to the doctor, or, you know, for procedure, or the time that you have to take off when you actually feel sick, right? So medication, treatment costs, and also opportunity costs, because you just cannot even work to make the money, right? Very expensive disease. And in fact, the care of diabetes in the United States, it's like $300+ billion, and it actually accounts for like 2% of the gross domestic product. So imagine one disease taking up 2% of the GDP. I mean, that's pretty significant, right? Now, the risk for death, if you're diabetic, especially if you had it for a prolonged period before it was diagnosed, your chance of dying is 60% higher than somebody who is not diabetic. So this is not a simple disease. It's not just oh, my sugar's a little high, I'm going to take some medication. It's a very, very serious disease. And the sad part about it too is that, you know, a lot of times before dying, the years leading up to that, you suffer with so many complications, the kidney problems, the need for dialysis, going to a dialysis unit 3 times per week, being exposed to all kinds of germs and so on at the dialysis center, right? The amputations, the wound infections, the need for antibiotics, course and course of antibiotics, depleting your normal we say flora, your normal load of bacteria in your body, right? The heart disease, the stroke, the dementia from all those mini strokes that happen year over year over year. And we see so many people presenting earlier and earlier with dementia, people in their 50s, 60s, that have dementia, that don't know what's going on. And it's very sad, people who coming up, hardworking people, right, knowledgeable people, but really just not aware of this issue of the blood sugar and the real impact on the body. Okay, so very, very serious problem. Now, when I talk about diabetes, I especially talk about type 2 diabetes, because that's the commonest one. Type 2 diabetes, of course, is the one where it's the one associated with obesity. Type 1 is the one where the pancreas fails to produce insulin, so that's the juvenile onset. So that one only accounts for maybe 5 up to 10% of cases, but the type 2, which is the big one, the metabolic issue, it accounts for like 90-95% of all the cases of diabetes. So very, very significant issue. Now, like I said, the issue of not knowing that you're diabetic is a common one, and almost every day up to today, and practically every day, we have people coming in with extreme medical situations, and they happen to find out in the hospital. Just, somebody, for example, if you're 60, you're living life normally, everything is fine, and you come into hospital for one problem, and oh my goodness, they tell you you're diabetic, sugar's high, 500, right? And this is how we're diagnosing a lot of people, right? There's a variety of issues, maybe just not going to the doctor, and of course over the past year because of COVID, a lot of people are just not even seeking medical attention. So if we thought the problem was bad before COVID, imagine now that many people have not been seeing the doctor, have not been getting blood tests. We probably have even more people who are diabetic, and then of course, not to mention people sort of, everyone's like tired and stressed, and so engaging in the comfort food, eating all the sugary, comforting kind of foods. And so we probably have an even bigger problem on our hands with this diabetes issue, okay? So I just want you all to sort of realize that this is not, you will feel good, right? But you will feel good until, like I told somebody just today, until the bottom falls out, basically. I don't know if that's a Mississippi term, or if it's, I don't know where that came from, but I say, when the bottom falls out, it's like, all hell breaks loose and everything starts happening. So another person was telling me that, they were fine, they've been diabetic for 20 years and they've been totally fine, and now, they have this big old sore or whatever, right? And then I had to say, look, you know, your body was compensating all this time, right? And, you know, our body has a remarkable ability to take care of itself and compensate and do things, you know. And then, of course, maybe the person gets prescribed medications and so on and so forth. But because the diabetes itself was not the you know, optimally controlled, so you still have all the inflammation going on, all the little blockages going on, the build up in a plaque in the vessels, and little blood vessels getting blocked slowly, and eventually when the blockages and all the inflammation and irritation just builds up, it just builds up to a point, and then bam, you know, it's over. You get a little blister and it escalates into a big old sore that goes all the way down to the bone in a matter of weeks. And then you will think that, oh my, but I've been doing so well, like I have never had a problem, and now I have this, and then I have a heart attack, and then, you know, they told me I have the mini stroke and so on, right? But it's just that the body compensated up until that point, and it just could not carry on any longer. And so it might appear like you were well, but it's just that these things were happening microscopically and silently, year over year over year. So it's so important for you to pay attention, you know, get your checkups once a year at least, even if you feel well, at least once a year, especially if you know that you probably could do better with your eating, especially where sugar is concerned, especially if you have a little bit of excess weight or a lot of excess weight. You can't just, you know, not think that anything is going to happen, right? Most likely things are happening microscopically in the body. And then a lot of times too, you might say, oh, well, it's so expensive and so on and so forth. But if you think it's expensive to take preventative measures, right, and to maybe catch things early, try letting the bottom fall out, because then is when you're going to have to spend money, right? Or if maybe you say you don't have it, they're going to hound you, you know, the collectors, the bill collectors will hound you, stress you out, so that in your recovery, you're so stressed out with all these bills, and it just impacts your proper full recovery, right? So as much as, you know, maybe sometimes it's kind of hard to get the money to do certain things, you have to think about the priorities in terms of, okay, if you keep yourself well, then you'll be able to function and work and think, you know, have new ideas to make more money in the future, right? As opposed to just kind of going along and then everything happens and then you have a short life or a non-productive life, because then you are alive for many more years to come, but you're not functional, you don't have a limb, your heart is not as bad, so you don't have the capacity. So just all these are the things that you have to consider, right? Basically, don't wait for the bottom to fall out. Be proactive, right? Try to find out, get an idea of what's going on. You might be fortunate, right? You might be in the 60% or 65% that is not either diabetic or pre-diabetic, right? But then if you continue to have those kind of liberal eating habits in terms of sugar and so on and so forth, and have, you know, carry on that excess weight, you know, for year after year, then even if you're not pre-diabetic or diabetic now, the chance of you being that way in the future would be very high, right? So I say, you know, basically don't just, you know, and then a lot of times too, maybe you're not optimal, but you're not diabetic, but you want to feel better and you deserve to feel better. And I encourage everybody to not just exist and sort of limp through life, right? But try to see how you can actually live life fully, you know, with a lot of energy and gusto, right? And so if you, you know, if you're wanting to do that, right, live energetically and with gusto, then, you know, see how or what you need to do to get that way, right? For 5 years, 10 years, whatever, maybe most of your life you have been sort of eating a certain way and living a certain way, and you recognize, because most people recognize when they need to make some improvements, right? But just making the step, taking the extra step to get there. And sometimes it's just that you probably need, you know, a little assistance from somebody who can really guide you with a structured system and sort of hold your hand while you get through it over a period of weeks to months or whatever, right? So you know, if you need somebody to help, and if you've seen some of what I've been talking about and so on over the time, and you feel like, okay, I'm ready, I of course have my coaching program where I help people get rid of sugar, cut down sugar, not zero necessarily. I'm not one of the zero sugar people, because I believe in being practical And essentially, I believe that if you minimize sugar, keep it to 0 or very low most of the time, then you can afford to have a little something on a special occasion, right? If with family or whatever, right? So we can, sort of get you to be not a slave to sugar, and then see those measurable health improvements, right? And then so that you can have this long, not just long life, but a long healthy life, right? Because if you're living but you're not able to really enjoy life, then there's not much fun in that. Okay, so just if you haven't had a checkup in the past 1 year, you probably should schedule a checkup. If you have a family history of diabetes or pre-diabetes, you need a checkup. If you are overweight, you need a checkup. If you haven't had one, you need to check your hemoglobin A1C, your blood sugar, whatever. It is important, right, for the sake of your health and your longevity and your ability to function and enjoy your life, right? So do that. Don't be one of the 8 out of 10 people who is not aware of their pre-diabetic state, right? Go and be the 2 out of 10 who knows, right? Don't be one of the 5, right, diabetic people who have no clue, right? Like my lady today, she had no clue that she was diabetic, and she was just so shocked. And you just don't want to be shocked like that, okay? So I encourage you all, go and get a checkup. Reach out to me if you're ready to make something happen, like you've been kind of putting it off year after year and you are ready to do something. And so if that is the case, that is you, I'd be happy to talk to you, just like a initial sort of discovery call, we call it. All right, I hope you all have a good day. Ask me any questions you may have and I will reply to them. And thank you for watching. Sheila, all the best. Take care.